I want to welcome you and thank you all for joining us this evening. I'm Sonia Atterley, the Executive Director of Bedford-Stuyvesant YMCA, and I'm thrilled to be here with all of you. YMCA is committed to doing everything in our power to support the City of New York, strengthen local communities, and serve those in need. This past year has been an unbelievably difficult year for us and for all of our communities. And we know families in parts of Brooklyn have been particularly affected by the pandemic. We're anxious for a return to normalcy. That will require protecting our communities and each other, and vaccination is one of the tools that will help to get us there. The CDC recommends that you get a COVID-19 vaccine as soon as you're eligible. But we know our community members want accurate information about the vaccines and may have questions for doctors. To empower our communities and support our vaccination education efforts, we're honored to partner with NewYork-Presbyterian to host a series of 12 webinars to discuss everything you need to know about the vaccines. For more resources, including eligibility and scheduling information, you can visit our website at ymcanyc.org/vaccines. Now, let me introduce you to Dr. Erica Phillips. Dr. Phillips is a graduate of the University of Virginia. She received her medical degree from Columbia University's College of Physicians and Surgeons in 1998 and completed her internal medicine residency at Hospital of the University of Pennsylvania in 2001. Dr. Phillips received the Master's of Science in Clinical Epidemiology and Health Services Research in 2003 from Weill, Cornell. Thereafter, she joined the Division of General Internal Medicine, where she conducts research focused on health inequities in racial and ethnic minorities. An integral part of her practice is bridging her clinical practice in weight management with that of her research efforts in the behavioral management of obesity. Dr. Phillips was one of the founding physicians of the weight management practice at Weill Cornell Internal Medicine Association. She's a diplomate of the American Board of Internal Medicine and the American Board of Obesity Medicine. Dr. Phillips, thank you so much for being here. And I want to encourage people to use the Q&A function to submit questions that may come up as you listen to Dr. Phillips' presentation. Dr. Phillips.
Thank you, Sonia. So I am thrilled actually to be here to be able to talk to my fellow Y family. And I can really say that as a former member of the Bedford-Stuyvesant Y as a user, a former board member of the Flatbush Y, and my son, who attends a local public school, is a recipient of the Dodge YMCA services at PS11. And shortly before COVID, my colleagues and I were able to host a wonderful community roundtable at the Coney Island Y. So I would say that definitely being able to talk with the members this evening about something that's near and dear to all of our hearts in terms of trying to resume a normal life in the heart of this pandemic is something that I'm thrilled to be able to talk with you about and hopefully be able to answer questions. So as we know, we want to make sure that we have a clear understanding of the sort of names that may be used tonight. And so SARS-CoV-2 is the name of the virus that we have all come to know that causes the COVID-19, which is the name of the illness. And as we know, and as time has evolved, we know this to be an infection, the COVID-19 infection, to be caused by respiratory droplets during close physical contact. And this is why we have sort of these distance limits of within 6 feet. The virus sometimes spreads from person to person by small droplets or particles that also may linger in the air. And what you can see here is that airborne transmission of these molecules where potentially these particles stay suspended. These droplets are extraordinarily small, things that we can't see with the human eye. And if we had to use the human hair as a comparison, which the human hair is anywhere from 60 to 100 microns wide, we see that droplets may be a little bit more than 5 microns, and that airborne transmission is by droplets or particles that are less than 5 microns. And so thus it's absolutely impossible to visually, to know, and to expect where these droplets may be, where these particles may be. And it's for that reason that COVID-19 still remains a serious concern, and why we need to be vigilant in our core basic public health measures of washing our hands, maintaining 6 feet of distance, and wearing masks. We see here that the percentage of New York City residents who tested positive within the last 7-day average still remains above a comfortable line of 5%, where it's about 6.3%. But the things about average that we also have to remember is that there's wide variation across the city. And when we think about, our Y families tonight, and in particular our Y families here in Brooklyn, and we look at variations just around the various neighborhoods, we see a percentage of about 4% positivity currently in Bedford-Stuyvesant, 9% in Coney Island, about 6% in Flatbush, lower rates in terms of downtown Brooklyn and Park Slope, and rates as high as 10 to 11% in East New York. And so again, the most important thing is that we need to continue to be vigilant about our practices as it relates to not contracting COVID-19. Sorry, not contracting SARS-CoV-2. But the good news is that there is a vaccine for COVID-19. We currently have available to us 2 mRNA vaccines and 1 viral vector vaccine made by Johnson & Johnson. All have been shown to be safe. We know that the mRNA requires 2 vaccinations, whereas the viral vector by Johnson & Johnson only carries 1. But there are definitely clear similarities across all of the vaccines. The first and foremost is that the vaccine itself does not contain live virus. The vaccine does not affect our DNA, and that you should get vaccinated even if you've already had COVID-19. So how far have we come? Well, as of this morning, and we take a look, and this is all public available data to everyone. The great news is that a little over 4 million adults within New York City have had a dose, at least, of the vaccine. About 3 million of those have received dose 1, and a little less than 2 million have received dose 2. But what we all know and love about Brooklyn, the most populous borough of them all, there are well close to 3 million people in Brooklyn alone. And so we still have a long way to go. 34% of the eligible Brooklyn population has had at least 1 dose. And that number is going to become important when I come back to talk about, well, what number do we need to get to in order to really think about protection across our entire population? But before we go into talking about the vaccine, it's really important for us to first even be talking about, well, how does our immune system work in the first place? In order to understand how a vaccine works, we first have to really be familiar with how our body works in terms of immunity. And so I like to call this sort of my cartoon regarding our immune system. And so we have 4 sort of main cells on this slide, or the first 2. We have what's called the helper T cells, and I call them sort of the outcriers. They don't really do much other than say, hey, B cells, I need your help, where are you? And so they're kind of the frontline folks who don't necessarily attack the virus themselves, but they know that they need to get help when they see the virus, and they reach out to the B cells. And so our B cells are actually the guys who sling and start to first try to attack viruses. And they do so by shooting antibodies. And what you can see here, this is a cartoon character actually of the SARS-CoV virus, which many may have seen in various pictures. On the surface of the virus is what we call the spike protein, which is at the heart of what it is that the antibodies are attacking and are trying to recognize. Then, once we've done that, we've created antibodies. The most important next 2 characters are what we call our memory B cells. And our memory B cells are important to remembering what the virus looked like in the first place. The memory B cells, now, once we've seen the virus, are the ones who recognize it and can create antibodies in a much more rapid fashion in response to the virus, never allowing it to fully attack our cells in the first place. But unfortunately, if a virus does attack our cells, what gets also brought in to kill the virus, as well as, unfortunately, potentially our own cells, is our killer T cells. And our killer T cells, as you see here, basically are looking for, on the surface, that protein or that virus. They recognize it, they inject granules in order to not only kill the virus that has infected the cell, but what you also see most importantly here is not only the death of the virus, but you also see the death of the infected cell. And this is going to become really important into understanding why there's such a cascade of other things that happen once you've been infected with coronavirus. So how does the vaccine then work? Well, as I've shown before, the virus has many different components. And if we think about this as the virus cell, we see on the surface of it, we see these spike proteins. We see the surface sort of core of the virus. And on the inside, we see the recipe. And this recipe book, becomes important when we talk about mRNA, which is just the genetic material that is used to recreate the virus. And so our mRNA vaccines are using the genetic material component of the virus, not the entire virus. And that is what our Moderna and Pfizer have targeted in terms of their creation of the SARS-CoV-2 vaccines. But we also have other components of the virus that can trigger or necessarily prime our immune system. And if we were to use this example, which is parts that trigger the immune system, we see that other vaccines that historically have been made, such as the hepatitis B and pertussis vaccines, would be samples or examples of vaccines that target surfaces of the virus. And then when we want to also think about the other vaccines that are on the market currently related to treating SARS-CoV-2, the Johnson & Johnson is what we call a viral vector vaccine. Viral vectors use the entire virus or the bacterium. Again, the virus is not live. The flu is an example of a viral vector vaccine where it's using inactivated flu in order to prime our immune system. Ebola is an example of a viral vector vaccine. And in this case, the viral vector vaccine is using another virus, the common cold virus called adenovirus, and injecting the SARS-CoV-2 virus into that virus and using that virus to then help prime our immune system. And so these are just examples of the many different ways that vaccines are made. There are no two exactly the same vaccines on any market. And again, it's most important to remember that the science behind the making of mRNA vaccines is not new. mRNA remains in the cell, and so this is an example of what the mRNA vaccine is doing. And so if we think about the genetic material as a recipe, if everyone remembers getting sort of always asking your grandma how they were able to make that special pie, and grandma never really wanted to share that recipe with you because she knew once she shared the recipe with you, then you would then have the recipe and you practice and practice and practice, and you would no longer need the recipe. You get to the point where you remember just from your memory how to create that amazing pie. Well, it's no different in this case. The goal is to prime our body to create these memory cells so that if we get exposed to the virus, that we know how to attack it right away. And we don't necessarily have to start from the learning process all over again. Most important is to recognize that this synthetic RNA never makes it into our DNA. There is no mixture, there is no combination. It never makes it into the inner component of our actual human cell that is responsible for our own genetic makeup. And so for those who have heard the myth that it changes your DNA, that's absolutely incorrect. It never makes it nor touches your DNA. And actually the synthetic RNA is protected in this molecule only for a few days, just long enough for the body to be able to mount an immune response and create its antibodies to be able to recognize the viral protein. After a few days, the entire makeup of the synthetic RNA is broken down naturally by our system. mRNA vaccines, again, are not new. The science of making them is well over 30 years old. In fact, actually, there are many different previous infections that there's been an attempt to use an mRNA to fight. For those of you who remember the Zika outbreak as it related to the Zika virus, rabies, influenza, cytomegalovirus, which the latter one is maybe a name not familiar to many. These are all mRNA has been used in the early stage clinical trials for being a means of also vaccinating individuals for many other infections. So what's the most important reason why we should be vaccinated? Obviously to protect yourself, but the most important is to think about the fact that COVID-19 may cause long-term problems that we don't fully understand. Currently, and this goes back to what I showed you earlier in terms of what happens with these killer T cells, remembering when we see this virus, not only is our body fighting and trying to break down the virus, it ends up unfortunately destructing our own cells sometimes in the process. And it sets off an inflammatory response in our body that actually can go on to cause problems to our major organs. And so some of those structural problems are structural changes in the heart, causing what we call a cardiomyopathy, which is, of course, a fancy medical term, which just really means an enlarged heart, which obviously then can progress to heart failure. It can cause worsening kidney function. It can increase the development of blood clots. It can cause difficulty, long-term difficulty breathing. Many have known the virus to cause a pneumonia and to affect our lungs, which is why many individuals who have been infected have ended up on a ventilator. This can cause permanent long-term damage called fibrosis, which is basically another fancy medical term for scarring of the lung tissue. And then obviously the complications that can occur from people who have had to be on a ventilator for a very long time. It is obviously not natural to have a breathing tube externally placed. And so this can cause long-term damage to the trachea, to the vocal cords, and just simply the way that we breathe. Excuse me. And then lastly, you may have heard about the feeling of brain fog, which is sort of this feeling of being confused, having a hard time thinking. And this has stemmed from inflammation of the nerves, which not only can cause brain fog, but weakness and paralysis. And there's been also signs of increased stroke in individuals who have actually had the infection. And more importantly, reinfection obviously can still occur. The other reason to be vaccinated is to protect your family and your community. A vaccine not only protects an individual, but a vaccine really protects our community. And as a Y family, knowing the heart of the YMCA is about community, that's an important thing to recognize. By being vaccinated now helps to protect those who are not of the age. As we know, our young children are not of the age to be vaccinated yet. However, the vaccine trials in children are ongoing. And so community vaccination protects the whole community, even those who can't get vaccinated yet, or those who may never be able to be vaccinated. For people who have ever had a severe allergic reaction to any vaccine, they are fearful of being vaccinated and may never be able to be vaccinated, given that they have had severe allergic reactions to previous vaccines. But why else should we be vaccinated? Really, currently, it is the way that we see forward in terms of ending this pandemic. It's really important to remember the history of vaccines and the way that they have basically changed how we live and the ability to live. If we look at, and for those who may on the call be old enough to remember the smallpox, it's a 20th century condition for which in 2019, there were absolutely 0 cases of smallpox. That's an amazing feat. So that means a 100% decrease in an infection that once used to take out hundreds of thousands to millions. And so we're talking about a 100% decrease solely because of a vaccine. Diphtheria in 2019, 2 cases. Polio, 0 cases in 2019. And so really there is no other way than to vaccinate if you are going to end a pandemic. And that is what history has shown us, and that is what we currently know to be true. So how do I know that the vaccines work and are safe? Each vaccine, first and foremost, has been tested in tens of thousands of people before it was ever released, not just tens of thousands of people here in the United States, but remember the vaccines have been tested in other countries. The vaccines have been held to the same safety standards and testing phases as every other vaccine that I just mentioned on that previous slide and showed you. In this case, the vaccine was tested against a placebo, meaning that those who were in the trials either truly received the active vaccine versus there were individuals in the trial who received, in essence, placebo, which is another name for potentially sugar water. So we know that they were really being tested against a true gold standard of did you actually receive the active vaccine versus not. To date, and this number has gone up because obviously our slide deck sometimes can't keep up with the pace of things. Well over 60 million people have actually received the vaccine within the United States. And so when we take a look at a comparison of all three vaccines, we know that all three vaccines in the trials prevented sickness and severe COVID-19 in over 94% of the study volunteers. And one of the most important things that we have to remember about why do we create vaccines? We create vaccines, yes, the goal is to reduce transmission, but the ultimate and first and foremost goal is really to reduce death and hospitalizations. Death first and foremost as the most severe case of getting an infection in the first place. And so when we think about that, I've had a number of conversations with patients where they're like, well, I heard that it's only this % effective and it's only that % effective. And the problem with the numbers that are being reported is that that doesn't represent the prevention of death. And those numbers don't necessarily represent the most important aspects, which is the reduction in hospitalizations. And so when we look at what has really the two most important, which is reduction in hospitalizations and reduction in death, these vaccines have done that. We're at the point right now where no, we can't say 100% what the transmission rate is and are they going to protect everyone from potentially transmitting the virus. We do have early evidence, especially from the Moderna trials, that there was a reduction in individuals who received the vaccine in actually having any positive nasal swabs after receiving it. So not only did they not were they not hospitalized if they got the infection, and not only did they not die if they got the infection, but there were individuals who just didn't get the infection even if they were exposed. However, we know that 100%, the most important aspects here is that they are safe and they have been effective in reducing death and reducing hospitalizations. Again, the Pfizer and Moderna are both mRNA vaccines. They require 2 doses. There are mild to moderate side effects depending on the individual, such as a fever, achiness, flu-like symptoms. But the truth of the matter is those side effects happen if you get the flu shot. Those side effects happen if you get the tetanus vaccine. Those side effects happen if you get a pneumonia vaccine. Those side effects happen if you get hepatitis B, if you get HPV. So if you've ever had a vaccine, we tell you the exact same thing as it relates to the potential side effects that you could potentially have after being vaccinated. In all of them, there was representation of people older than the age of 65. In all of them, there was representation of Black and Brown adults as well as Asians. And in all of them, they were tested in populations that were younger. The Pfizer is approved for 16 and older. Moderna and Johnson & Johnson are approved for 18 and older. And this is going to become critically important for getting our kids back into the school systems as it relates to, in particular, our high school students. How is a vaccine created so quickly, which is always a question that people become concerned about. And again, this is a reflection of showing how efficient we can be as a country when we are all working together and when all hands are on deck and everyone is focused on the same goal, which is vaccine. Again, none of the phases were skipped in making either 3 of the vaccines that are on the market, but what did occur was that they were overlapped. And more importantly, one of the longest phases, which can be anywhere from 1.5 years to 2 years, was shortened by having the ability to start to manufacture and be prepared in a rollout as soon as phase 1 was started. And so manufacturing, which usually would not start until phase 3, in terms of packaging, in terms of how are we going to get it out to people, all of those things were ongoing at the same time that the phases were occurring, which allowed the vaccine to be on the market as fast as it was. But the most important thing, it actually meant that our government was working together. The FDA and the CDC, everyone prioritized this. And so all hands were on deck. And again, it just reflects what we can do as a country when we are united rather than being divided. Obviously, what's also in everyone's mind are what about the new strains? And so again, going back to that earlier diagram about what the virus looks like and what the vaccine is primed to do, which is to recognize the spikes on the virus, the spike protein, we see that the original SARS-CoV-2 represented here, just using colors to make a difference in terms of the red spikes, we see that the variants that we're beginning to see, the United Kingdom with the yellow spike, the South African variant with a green spike, and the Brazil-Japanese variant with a blue spike, simply represent that the virus, the longer it is allowed to continue to jump from person to person, gives it more time to change itself, to transform, and to create new spikes. However, we do still believe that the current vaccines are the best tool to stop mutation. The more people that are vaccinated, the less that the virus is allowed to remain in transmission in the first place. The longer we allow this virus to be jumping from person to person, from country to country, is the more variations that we allow it to become. Vaccines help to protect us against new strains, but they may not be as effective. But that does not mean that the vaccines are still not, that does not mean that we're not recommending vaccines. So what else should we know about protection? Again, I started with this and I will end with this, which is that yes, some people have become reinfected and the vaccines might provide better protection, not only for those who have not been infected, but for those who have been infected and may potentially become reinfected. Still getting vaccinated may help to continue to boost the immune system to protect against hospitalizations and death. If I get vaccinated, do I still need to wear a mask and practice social distancing? Yes, we're still not at the point where we can say what the transmission will be for those who have vaccinated, but we're beginning to see changes there as well in terms of the recommendations. And how long protection will last remains a studied, but ongoing question as to how long we will be protected. For those who have recently saw some of the recent data, there's suggestion that Moderna may give us 6 months of protection, but we don't know if past that. And so we know that there's still many unanswered questions. But what we do know is that we still need to practice our core 4 actions to stop the spread, which is wearing masks, maintaining a social distance, washing your hands with soap and water for at least 20 seconds, getting tested if you feel sick, and if you're sick, to stay home. And I'll sort of end so that we can open up with questions. What the most important thing is that while there are a lot of unknowns still out there as it relates to how long the vaccine will last, there are also those unknowns. I would say the knowns outweigh our unknowns. And what we do know about COVID-19 is that it can be a lethal infection with long-term sequelae. And so if we had to weigh our risk of actually the vaccine versus long-term risk of the vaccine versus the long-term sequelae of the SARS-CoV-2 causing a COVID-19 infection and thus having multi-organ involvement, the risk of that multi-organ involvement far outweighs currently, from what we know, any risk of unknown long-term sequelae from the vaccine. So I will end there to allow for questions.
Thank you. Thank you so much. So if there are any questions, if you would go ahead and put it in the Q&A box here on the screen, that way we can ask Dr. Phillips to answer those questions. And I myself, I have a few follow-up pieces I wanted to ask. You mentioned that a lot of the side effects that occur are essentially similar, more or less, to the side effects you would have if you had the flu.
Or if you had the flu vaccine, you mean side effects to the vaccine?
Of the vaccine, yes. Yeah, side effects of the vaccine are similar to what you would expect if you've had the flu. Are there any further or more detrimental side effects up to and leading to death that have been documented, or is a minute possibility of occurring?
Sure, I would say that I don't think that there have been any surprises as it relates to side effects from the SARS-CoV-2 vaccine in comparison to any other vaccine that's out there. There have been reports of, and again, in a few minute individuals, a local rash at the site that has sort of been sort of like a prickly-like rash. But have we seen that in other vaccines? Yes. Have we seen flu-like symptoms, in terms of achiness and colds, upper respiratory infection symptoms? I think the old adage, there's so many people who say, I got the flu from the flu vaccine. Did they get the flu from the flu vaccine? No. Did they feel like they had the flu after the flu vaccine? Yes. No different here. Did they feel like they had reactivation of their initial COVID infection? Yes, we've seen people who, because they had COVID and now they get the vaccine, remember, our memory B cells start to attack. It's like, oh no, not you again. And so what happens? And so we have this heightened immune response. Our immune system is meant to defend, but our immune system can also not only defend, but make us feel bad in its defense. And so the symptoms, the side effects, I think, from the coronavirus vaccine are really no different than the symptoms from any other vaccine.
Thank you so much for answering that question. I do have a question from Helen James, and Helen asks, how long do you have to wait before you get the vaccine after having had the COVID-19 virus? Thank you, Helen.
Great question. Yeah,
Great
question. So there are a couple of things to think about in terms of timing. One, and I'll sort of answer the last one before I answer that one, which is right now, in particular, as the coronavirus vaccine was being given at the same time that we were in flu season, it was felt that there should be at least a 4-week window from the period of when you received any vaccine in comparison to when you should receive the coronavirus. And the same thing as it relates to infection, in terms of a minimum of at least 4 weeks should be between an active infection and when you actually receive the coronavirus vaccine. But the recognizing that each one of us has had a different type of coronavirus infection, in the sense of those who have had COVID-19, there are people who test positive and have no symptoms at all. And there are people who have obviously been hospitalized and seriously ill. And so the best answers to the question in terms of how long you should wait really should be a discussion with your provider, because it really also is contingent on the severity of your primary infection. And so, there's no perfect answer to that, in the sense of it really does have a little bit of independence based on the individual, because not every person's COVID-19 infection has been the same.
Okay, thank you for that. There's some questions about, and some comments in the ether about the different types of vaccines. We know we have, the one shot, and then you shared examples of the two. Lots of, WhatsApp chats and all sorts of, interesting information going back and forth about which one is the best, which is most effective. Are there any ones that should be, recommended over others, or more effective?
So that's a great question. And I think, unfortunately, a lot of the chatter has occurred because of releasing numbers, statistical numbers, that, in all honesty, the average adult can't decipher. 94% versus 91% versus 60% versus 85%. In particular, if you track the Johnson & Johnson numbers, what sometimes people didn't even realize, that the numbers that were being released represented, remembering that Johnson & Johnson was tested at the same time in 3 different countries across several different continents, actually represented their effectiveness in each one of those various countries. And so you may be quoting a number that wasn't even in the population here in the United States. It was the population that was tested in Brazil. And so I like to step away from those, what are really efficacy numbers, which are numbers that relate to what happens at the end of a clinical trial, because what really is important to know is, 1, did they reduce death? Yes. In all of 3 studies, there were no deaths related to the trial itself. Did they reduce hospitalizations? Yes. Those are the 2 important numbers to understand. When we start to talk about all of the various efficacies, we're getting lost in these numbers. Now, other thing that we do know is that clearly, unfortunately, depending on where you get vaccinated, you don't necessarily walk in having the choice of which vaccine. And so the most important thing is getting vaccinated, not giving in and not falling, I like to say, victim to all of these various numbers, that at the end of the day, the one number that makes the biggest difference is your risk if you don't get vaccinated. That's the number we should be focused on. If we're not vaccinated, the risk of the transmission of COVID-19, the risk of the transmission of the SARS-CoV-2 virus, and our risk of death. And that definitely is protected by all 3 vaccines. And so the best answer is to get vaccinated. Don't get caught up in the various numbers, because the numbers really require far more detail and understanding. Well, is that number related to the trial in Brazil? Is that number related to the actual numbers in the United States? Oh, wait, I thought that was the number. At the end of the day, the most important thing is that there was reduction in hospitalization and death, and that's what we need to focus on.
Thank you for that. You shared with us earlier that upwards of, I think, 30 or 34% of New Yorkers have been vaccinated.
No, that was Brooklyn specifically.
Yeah,
that was Brooklyn specifically.
That's Brooklyn. Well, shout out to Brooklyn.
Yeah.
What happens if they don't take the second shot? What are the risks involved there? And how important is that to the success of the vaccination process?
That's a great question as well. And so I look to our fellow Brits who have taken a totally different approach to the vaccine program and have focused on getting the most people vaccinated. And so they've done the one-shot deal. And so if you haven't been following their trends, what the UK has done is focused on, okay, we know that if we hold back vaccine in order to ensure that everyone gets 2 vaccines, it takes us a much longer time to vaccinate everyone. But what we need to get is at least 1 shot in every single person as soon as possible. And if you compare actually the drop in transmission rates right now, the United States versus the UK, their trends are actually exponentially faster, going downwards in terms of rates. Obviously, and this goes back to why don't get caught up in the numbers. So one of the other reasons that you see in the trials potentially a lower effectiveness as it related to the number comparisons between Johnson & Johnson to Pfizer and Moderna is a 1-shot versus a 2-shot deal. Well, obviously, if we think about many vaccines in our life, I could raise my hand. If you ever had hepatitis B, it's 3 shots. If you've ever had pneumonia, it's 2 shots. If you've ever had HPV, it's more than 1 shot. Like many of our vaccine series are more than 1 vaccine shot. But that doesn't mean that you're not protected. Perfect example is hepatitis B. Again, we actually, if you were to test and look at people, even though you're supposed to get 3 shots, we can say a lot of people never get the 3rd because it's almost 6 months after the first one. Half of the time, who remembers? If you're, how many people, healthy adults see their doctor within 6 months? So of course you forget. A year goes by and you're like, oh, wasn't I supposed to get this 3rd shot? Oh, Are many people protected? Yes. So do you have protection with just one? Yes, I think the British data clearly shows it. Are you better protected with two as it relates to Moderna and Pfizer? Yes, you're better protected with two, but it doesn't mean that you're not getting any protection at all when you have one. And most important is to recognize that right now, the recommendation is that you are truly not vaccinated. Full effectiveness for Moderna and Pfizer is 2 weeks after completing your full vaccine. That doesn't mean take your mask off. It just means some of the newer policies where people who have been fully vaccinated and are, within their same networks can actually be in a room potentially at least 6 feet apart with not having a mask is now a possibility. So I encourage everyone, if you start the series, to finish it if you've gotten a Moderna or Pfizer. But there is definitely, I think, data demonstrating that one shot is effective and can have an impact on the population. And the British data is definitely showing that.
Thank you. We have another question from Michelle. And Michelle asks, can I get an asymptomatic COVID test? I've had a family member who was asymptomatic COVID. I think she means to say negative test results, but got COVID 2 days after getting the first vaccine.
Yes, I can attest to a patient of mine who got her first shot. She's a nurse, so high exposure, and ended up getting COVID. I think maybe a week or two after her first vaccine, however, was completely asymptomatic. Unfortunately, her husband, not a healthcare provider, not vaccinated, ended up getting it from her and ended up in the hospital. So this goes back to how important it is to vaccinate not only yourself, but how important it is to vaccinate our family members and our community. She did the right thing. She started her vaccine series, but unfortunately, she is a high-risk healthcare worker. She's on the front lines. She remained completely asymptomatic, and the only reason that she even recognized that she was positive was when he got sick. They all got tested and recognized that she was the one who actually had been the infected primary one. So yes, there are people who start their vaccine series, get infected, and that's an unfortunate thing. But again, that's a perfect example of she didn't know it because she was completely asymptomatic. And so her body had probably already started to mount an immune response so that when she was exposed, she neither ended up in the hospital, didn't end up with any symptoms whatsoever, and just quarantined at home until she was negative.
Thank you for that question. Thank you so much. So at this time, what I'd like to say is, Dr. Phillips, this has been tremendous. We thank you so much for all of this information that you've shared with us this evening. And for the folks who've joined us today, thank you for our Y family. Thank you for your interest in the vaccines. Vaccination is a very important tool in making ourselves, our families, and as you heard, our community safer, especially our Ys. For resources on eligibility and scheduling a vaccination appointment, you can visit the YMCA's website. It's ymcanyc.org/vaccines. We also have 2 YMCA locations in Brooklyn where you can now be vaccinated 6 days a week, the Flatbush YMCA, as well as the Coney Island YMCA. And if you look at the numbers that Dr. Phillips shared with us, you can tell how important it is to have vaccines available in those 2 communities. So thank you very much. And we appreciate you all being here this evening.
Thank you. Have a great night, everyone.
Great night. Thank you.